My name is Darian Laird, and I am the Director of Communications for the Global Coalition for Radiotherapy. And we're so excited for you all to join us today. We're really excited about this new initiative, and a big thank you to Kyra McComas, who is going to introduce the initiative in just a moment. We are going to have on the agenda for us today kind of a broad range of individuals, including one of our co-founders, Pat Price, who is with us, Professor Pat Price. Thank you for joining us. Ben Lee, Yulia Loska, Lindsay Rice from Radiotherapy UK, and then, as I mentioned, Kyra, who is launching this initiative within the GCR. Just a little start to what is GCR. So it's possible that some of you have joined some of our webinars in the past. We are a group, and if you haven't, then let me give you a quick introduction. So the GCR brings together, we're a collaborative group. We bring together patients, charities, clinicians, scientists, health experts, and industry partners. And our goal is to create access to quality radiotherapy worldwide, equitable access to that. And a couple of ways we do that is by hosting our webinars and roundtables, professional-led webinars. Also, we have established the Radiotherapy Task Force to address global crises, the response to COVID and the backlog to cancer care, as well as the efforts in Ukraine. That's been a really big focus for us this last year, and we're really excited that Yulia can be with us to talk a little bit more about that. Also, a huge emphasis on advocacy through collaboration. We have a GCR advocacy toolkit that's made available on our website. And we'll talk a little bit about some of our stakeholders who have been great examples through that. Lindsay Rice, who is here with us from the Radiotherapy UK charity, as well as our publications that Kyra has partnered with us on publications. The Lancet Oncology has published some of the stuff that's been going on with the Radiotherapy Task Force to support Ukraine. And most recently, we published a white paper on closing the care gap and digital transformation. And Pat is going to spend some time sharing about that as well. We're really excited, though, for this initiative because this is an opportunity to work with the workforce, the up and coming workforce that's very passionate about your field. And I'm going to give the time to Kyra to talk a little bit about that.
Great. Thanks, Darian. Thank you all for coming. I really appreciate, everyone kind of jumping on, and I know it's busy and clinics are going. So good morning, good afternoon to everybody who's here. So when I first joined the GCR, I was, I'm still really the only resident and the only trainee working with them. And I realized how important their initiative is for advocacy, knowing that radiation oncology is a cost-effective and innovative field, and we really need to push for it and continuing to help provide equitable and efficient access to it in third world countries, first world countries, second world countries, all over globally. But the reality is, we don't see that side of radiation oncology in our training. We aren't taught to advocate directly, and so, we need to advocate for our field, especially as we are, going to inherit it. It is, as trainees, this is the future of radiation oncology. So with that, I wanted to establish this resident partners group with the GCR, who has been so generous with their support and connections, and really make sure that radiotherapy is a growing, sustainable field that is adaptable to the increased needs of cancer patients around the world. So I came up with this vision statement for this group that, really the idea is we have a passion for equitable and high quality radiotherapy. And I'd like to really foster a community of trainees globally through education, advocacy, and collaboration. And so this can take many forms, things like writing, whether it's strategic publishing in professional journals or medical humanities journals or magazines or editorials, calls to action, even things on social media, Twitter, utilizing that, and LinkedIn, things like that. There's also obviously a critical lobbying component where we can, petition and write to legislators and, go directly to our policymakers to really advocate for our field and for our patients. And also presenting in front of larger scale groups like ESTRO, ASTRO, ECO, and even like ARRO, which I'm a part of ARRO, which is, for those of you who don't know, is the American Society for Radiation Oncology Residents under ASTRO. Travel is obviously something to consider. If you have an idea and you want to help a global community, in X country or Y country, certainly it would be neat to get on the ground there and see firsthand, how you are helping these people and how you can help them. Education, I think, is important, especially with the war in Ukraine. We'll hear from Yulia in a bit about, access among trainees when humanitarian crises strike, and how we can better facilitate broader education, sharing our education, and kind of collaborating together to make sure our training is up to date, and these kind of bumps in the road don't throw us completely out of the loop with our training. And you know, as I've already discovered with the GCR, mentorship is an important part of this, because we have so many connections, and the GCR is such an incredible platform with which to reach out and connect with other people, and really find some good mentorship. And then obviously meetings, which is always part of it, but you know, less attention to the meetings and more focus on action. So that's kind of my vision and my idea for this group, and I think it will be kind of a changing, morphing entity as more people join, and I get all of your input and collaborations and your ideas and what you want to do. So mostly it's a platform for us to connect and really on a global scale. So thank you all again for coming. I think next I will pass it on to hear about a little bit more about the international collaboration with Lindsay Rice from Radiotherapy UK.
Hi, yes, thanks for having me. I'm Lindsay Rice. I'm a therapeutic radiographer consultant now working for the charity Radiotherapy UK. So the charity does a lot of advocacy work, obviously just within the UK kind of area at the moment. We were founded in 2010, and that was initially to support research and the radiotherapy community within the UK. But our mission is for everyone in the UK to have access to the best radiotherapy treatment and support. So how do we promote the profession, support the workforce? So we do a lot of campaigning. We've been campaigning since 2018 with a Radiotherapy for Life campaign. And that was founded to call for equality of access to radiotherapy across the UK. Then, of course, the pandemic hit in 2020, and it sort of became quite clear that it was going to have such a massive impact on cancer patients in the UK and accessing treatment, accessing diagnosis, as we can appreciate everywhere in the world, really. So in this response, we launched the Catch Up with Cancer campaign, and this was obviously aimed to highlight not only the backlog that was developing, but also the fact that patients were dying unnecessarily and how radiotherapy can provide that COVID-safe, cost-effective, and some of the solutions to the backlog. So the campaign's run several parliamentary drop-in events in Westminster for MPs, sort of to inform them what cancer services look like in their constituency. We've launched petitions for change, which we're currently on, I think it's about 385,000 signatures. We've held media days outside Parliament, unveiling a large map of the UK, waiting times, really just campaigning and lobbying to highlight the problems that we face in the UK. We've also been instrumental in supporting the setting up of an all-party parliamentary group for radiotherapy, which we're the secretariat to, and that group brings together MPs and peers from across the political and radiotherapy spectrum to debate key issues and campaign together to improve radiotherapy services. So this enables us access to really supportive MPs that table a lot of questions in Parliament on radiotherapy for us, and have also helped us develop the Radiotherapy Manifesto. So we're now in a position where, as a charity, we're quite recognised and respected within the cancer space in the UK, and we can regularly feature in media to highlight radiotherapy and its effectiveness. And our charity chair, Pat Price, who's already been mentioned, is often asked to comment in the field. So we're really trying to sort of raise the profile of our profession and how amazing it is, really. We do a lot of workforce engagement as well, which is one of our key elements in promoting and supporting the profession. And we engage directly with the front line, and we think that's really important. We have regular contact. We've got a network of champions that we 25 people who work on the front line who we meet with regularly, and they're radiographers, physicists, engineers, and they ensure that the charity continues to support the workforce effectively, and they share intelligence with us of what's currently, you know, the current landscape, so that we can keep our lobbying and campaigning up to date. We can also conduct regular workforce surveys, so we get intel from the front line. The latest survey we did in August received a a response from just over 10% of the radiotherapy workforce. So we'll be publishing those results in the next few weeks. We host webinars to share best practice and talk about new advances to support the education of the workforce. This can also spread out to patients as well, if it's subjects that, cover patient support. We're active on social media channels, Twitter, Facebook, Instagram, and LinkedIn, where we share research, highlight the profession, support our colleagues, talk about all the great work that's being done all over the world, and also share our campaigning and our messaging. So this is a great platform to engage with the workforce and with patients. We've got a daily newsletter that goes out to over 1,500 subscribers, and that's really a roundup of the latest media and research relating to radiotherapy, so that helps professionals keep up to date and informed. So we're a trusted source of kind of professional information. So we are a really small charity, but I believe we pack quite a big punch. Yeah, so that's kind of what we're doing in the UK at the moment in terms of advocacy and campaigning.
Thanks so much, Lindsay. Yeah, and absolutely a big punch. So we, Radiotherapy UK is a huge stakeholder in the Global Coalition for Radiotherapy. And like Kyra mentioned, the opportunity for like on the ground work, they're just such a great example of that. So thank you for sharing that. Okay, we have an opportunity now to hear from Yulia Losko, who is Ukrainian in Stanford doing some training. So talk to us a little bit about your experience there. This is like the big global training moment.
Right. Hi. So I hope that you can hear me. My name is Yulia Losko. I'm the Radiation Oncology Resident from Ukraine, from National Cancer Institute that you basically can see on the pictures. My way as a resident is a bit harsh because of the very hard times in my country right now. And unfortunately, like the thing is, the main goals of the residency that are theoretical knowledge and clinical practice are now very hard to get in our new reality. We've got so many questions, and those questions are all connected to safety and lack of doctors, lack of people who actually come. And basically when you go and you really want to train, now you face the reality of the war, and every single day you're just not sure if you can survive in that hospital. Unfortunately, hospitals are not the safest place anymore. And we try to show it to the world community, what is going on over there, how the hospitals are being bombed, radiation oncology departments are destroyed, and everything is going on like that. And you can just understand that all the residency programs are now not fully covered. And unfortunately, my residency program was not any different. And yes, I was very lucky to get a chance from Stanford. If we go to the next slide, please. Stanford actually gave me the opportunity to come and do my training, my observership that I'm going to do for 6 months in here. During it, I can actually feel like a real resident, and as well as do lots of research, because right now I'm the researcher and I'm doing a lot of things connected to radiation oncology. But at the same time, I can visit all the chart rounds, I can visit all the resident lectures. I get the huge support from all the doctors who try to train me the same as their residents. And that is actually something we really try to do and encourage other institutions to do. So if you just look at our next slide, you can see how many universities and how many institutions actually offered some places for Ukrainians to train over there. We basically support and we kind of try to have more Ukrainian doctors, Ukrainian women, because unfortunately men cannot leave the country right now, to train in institutions in the US and all around the world. Right now, we already have some places in US, in Australia, and in Canada who have offered the training programs from 3 to 6 months. It can be even longer, but it all depends on institutions, to train our doctors with the main goal to make them better specialists so they can come back home and train another doctors. So in this way, we can actually become more prepared for the future of radiation oncology. Even now, during the war, we already have lots of new techniques that appear in Ukraine, and we actually expect much more things to be changed in the future, in the nearest future, and we really need to be trained for that, because unfortunately we didn't have that many technologies before, but now we will, with a huge support from the world society. So basically what our goal is, we really want to ask all of you, to encourage all of you to ask your institutions, ask your hospitals, if you really wanted to participate, if you want to help with training, if you have something to share with us, any training opportunities, any lectures, it would be really nice. I'm sharing on my slide my personal email as well as the email of Natalia Kovalchuk, who is a medical physicist in Stanford, who actually helped us with the opportunity, with the opportunity in Stanford, as well as the other trainee who was here from Ukraine, and now she's already back to Ukraine. So basically, if you really want to help us and to participate, please reach us out. As well as my goal when I come back to Ukraine is to start the online opportunity for lots of Ukrainian residents as well as doctors of educational programs. So if you want to really take part in that, if you are somebody who wants to give some lectures or just help to organize those online materials, please also, we will be really happy to see all of you, all your international community with us. And I'm really grateful to be here right now. I really hope that all of you can know about the reality that are going on, and basically we are grateful for every help, any help that you give. Every person who comes to me and tells we are sorry and we want to help, it's like a big thank you to all of you from all of the Ukraine. So thank you for giving me a chance to speak to you today.
Thank you so much, Yulia. And I'm so glad you mentioned Natalia. Natalia has been a huge part of the radiotherapy task force to support Ukraine and doing so much good in Stanford, just presenting at the Astro conference. And this is just really inspiring. This is what this group has the potential of doing, right? Connecting, networking. I'm already seeing in the chat, there's so many people who have these interests and these goals to help get equitable access to radiotherapy in their own countries of origin. And so thank you, Yulia, for presenting and for sharing what you and Natalia and your team has been up to. So hopefully this will, once we divide up into those breakout rooms, we can continue to discuss this as well. I'm going to turn the time over now to Ben Lee, who has done so much in terms of access. And just by introduction, he also is the president and founder of the Rayos Contra Cancer. And so we're really excited to hear from him, just kind of a strategic discussion of how we as a workforce can get together and make an impact on a global level. Thanks, Ben.
Good morning, everyone. Thank you so much. Really nice to hear your story, Yulia. And I'm really inspired by all the work that you've done too, Natalia, for setting up these opportunities. One thing I heard and sort of been hearing is that education is so important, and we can't underscore it enough. It's essentially what makes us capable of providing radiotherapy. So that's been my big focus. We can scroll down here to see a little map of the world. Many of you are probably familiar with this. Interestingly, this shows access to radiotherapy in terms of the amount of equipment, but it doesn't really show how equipment is used. So this is kind of like at least when I entered the scene, it was more like a silent crisis, although there are many silent crises, but I'll get into why I decided to focus on education and training. We can go to the next slide. So pretty much I entered as a noob, but a strong desire to help. And I really relied on conversations with radiotherapy clinicians in other countries to guide me. Meeting lots and lots of different clinics, talking with different levels, from resident to the boss at the department head, and also getting to know stakeholders and their different views, including the big vendors and also some of the smaller vendors. We can go to the next slide. I did come across a strong desire for training. And then I guess it's obvious if you're in the other country, but for people looking from the outside, sometimes they want proof. So this is just a small study that we did showing willingness to pay out of their own pockets for training. And then we founded Rios Contra Cancer in 2018. We're a 501c3 organization based in the United States. And our mission is to create sustainable access to high quality, timely, and affordable radiation treatment for cancer in limited resource settings globally. And for those new to Rios Contra Cancer, it's Spanish for Raise Against Cancer. We can go to the next slide. So I'll share what Rios Contra Cancer has become today. This might be a review for some of you, and for others, hopefully I don't go too fast. Feel free to type in the chat if you have questions I can get to afterwards. So we essentially designed a solution that is low cost and scalable and helps reach multiple clinicians at a time, focusing on different regions of the world. We do Zoom calls just like this, and we build and design longitudinal curriculum. Typically, these are anywhere from 4 to 6 months in length with a session each week. They're about 1 hour long, and it's a mix of didactic and some case-based demonstrations where we can use case sharing and online TPS. And we also try to schedule the sessions really catered around the clinic's schedules. They're all free, and we have content that is created by coordinating a team of volunteer educators. On the right, you can see some of the principles that we kind of steer educators towards to emphasize really practical topics, try to share things that they've gained through experience and that's hard to find in textbooks or in papers, and really try to simplify what we're doing in radiation so it can be easier to provide high quality care. We curate the work they do, so kind of do first round revisions and try to also execute best practices in education. Next slide. This is just kind of a glimpse of what our sessions are like. We try to make these engaging. Really, if you've joined, you'll see it can be quite active in the chat where we're just answering a waterfall of questions and sharing knowledge. It's very fun, very exciting. We can go to the next slide. And in addition to the live calls, we have asynchronous elements of our training programs now, where we're just trying to almost create like a classroom where there can be homework assignments or can be exams. And we think that this helps promote attention and retention of knowledge. Next slide. So to date, we've created 7 core programs and run these programs in 20 times, sorry, 7 courses and run the programs 20 times. On the left, you can see the titles of the different training courses. And then on the right, you can see the different regions that we've run these programs in. We'll conduct these programs either in English, if they're English-speaking countries, Spanish, if they're Spanish-speaking countries, and then we have dabbled with a little bit of hybrid English-Arabic for the Middle East, and also French for Francophone Africa. Next slide. And this is a little bit of the impact that we're measuring and a little bit of how we operate. So remote training we found can lead to sustained improvement. This is kind of like I guess like a phase 2 prospective trial, which those things are weird. But basically we had an on-site training visit by some volunteer educators and then followed up with either remote education or no further education. And we found that there were improvements in clinician confidence after remote education that was sustained. We can just go to the next slide. And we found that these initial promising results in our first pilot hold true across the programs that we've run subsequently. So across the 20 iterations that we've done, we've found consistent improvements in confidence and in knowledge across multiple domains. I won't get too much into the minutiae here, but we have about 1,000 paired respondents for each of these. Next. We're getting a little more businessy too, and saying, you know, like how much would you recommend this to a friend? These are very highly recommended. So 9.5 out of 10 is our average recommendation score. And these are based on anonymous input. So I think we're doing a good job, but I'm really trying to each day think how we can be better, Something I've started to become cognizant now is that we have lots of participants attending and we want to be good stewards of their time. So I want to make sure if they're joining an RCC Zoom call for an hour, but that's like a really good hour in their day. And it really, we're protecting their time and helping them become more efficient. We've had over 2,500 clinicians trained, and about half of our participants are joining as a group of 5 or more from their clinic. Here you can read just some vignettes for one radiation oncologist in Nigeria after an IMRT training program. He said he started to see dramatically fewer head and neck toxicities. Many patients are able to complete treatment without needing breaks, whereas before head and neck treatments were quite toxic at their center. So that was like pretty amazing. And that was just within a few weeks of doing our training program. And then for physicists, numerous comments about how their treatment planning has become better, faster. Instead of needing to work on a breast IMRT plan over several days, they can now do it in a few hours. I think that we're training future, as Kyra said, you know, this is our generation. So we do want to inspire new leaders, not just here, but also abroad. Next slide. This is a partial map showing just the clinics that we've had over 20 participants from. And then out of all of our participants, they've come from over 600 clinics across 75 countries. And you can see that although our name is Rayos Contra Cancer, when we started with work in Latin America, we really have spread across trying to encompass all LMICs. Next slide. And then as we've grown in scale, we hope that this is translating to patient lives impacted per year. The really nifty thing about radiation is if you help a physicist do QA correctly, you suddenly like impacted like hundreds, if not thousands of patients. So I'm really happy about the impact that we've been able to have through these training programs. Next slide. And we are building opportunities in global oncology. So really excited to be here with you all and talk about what more opportunities that we can build and create, sharing our special skills towards special activities. My strategy has been to break up large projects into discrete small pieces that are manageable for any clinician who wants to volunteer and get involved. And then a lot of what RCC does is it simply guides a volunteer so that they can perform their role and really work as a team. Next. So we have probably over 200 professionals at this point, coming from over 100 different organizations, both academic and private, mostly in the US and some in other countries. And we can go to the next slide. And this is just a little behind the scenes. We can go to the next slide. So let's, I guess I'll provide an exposition of things to think about before we go into our breakout sessions. So when I was starting RCC, I really wanted to help improve the radiation experience. Kind of similar to what Kyra was mentioning. You know, we have this passion to serve and to use our talents and abilities and time to help others. But what's the best way to spend our time and to use our skills? So we could focus on either clinics, human personnel, or health system infrastructure. At least this is how I divided things up. And then within each, there are different avenues that you can pursue. This, I mean, you can take a picture of this and then try to zoom in to read it if you want. But if you go down, I explored working with clinics, and I found that ultimately there were already some organizations that were sort of focusing in this area, and that donating equipment kind of gets dicey. The IAEA doesn't like it. There's some controversy. And then by and large, many clinics already had equipment, but just weren't able to use it to its full potential due to training. So decided not to focus on sort of equipment and hardware, software stuff with clinics. Next. Then you can consider trying to focus on the health system infrastructure. And you know, some of these things are trying to focus on things having to do with patients, do things that focus on like attitudes about treatment decisions or mitigating corruption, or trying to elevate radiation's place within the integrated health system. I felt like I should just get some more experience first doing practical operating work before focusing on big level infrastructure. But with GCR, this may be something that we have avenues open towards, because we have pretty diverse and strong stakeholders. At least for me, I started with something a little simpler. So the next slide just kind of shows that I ultimately saw education and training as the best place to focus my efforts, because it was low cost, there's sort of immediate impact, and it leverages our skill well. And so RCC's assets can be tapped by those with initiatives. We have a library of educational content, operational experience, and a network for organizing training. We can help identify suitable partners in other countries, and we have scalable materials we can use to complement any in-depth training initiative. We have also sort of this niche in global oncology where we're seeing it with fresh eyes, and I feel like we're developing an attitude towards global health that is new and sort of thoughtful of what modern challenges are. And I feel like a lot of the things that we're doing in radiation oncology could be applied to other disciplines in cancer care. And so there are kind of like three priorities that we could meditate on today, if you'd like. I think Kyra outlined sort of several mechanisms for how to focus our efforts through writing, lobbying, travel, education, mentorship, or meeting. And we could consider applying that to help improve scale training, to help deepen partnerships, and develop like deeper understanding about challenges, or to promote cross collaboration. And I guess this is my last slide. You could take a picture of this one too. I don't have enough time to go over everything.
Ben, thank you so much. This is really incredible what you've been able to do, and provides a lot of opportunity for us to discuss in the breakout rooms. And I'm going to turn everything over to now Professor Pat Price, who is GCR co-founder, and she is just, like Kyra mentioned, this opportunity for mentorship. Pat Price is just a huge champion in the UK, but also globally, as she developed this incredible organization, the GCR. So Pat, go ahead.
No, thanks. Yeah. And I won't take up too much time because I know we want to get to the breakouts, but just fantastic. And Kyra, what a great opportunity. Remember, you guys are the future. We were the future once, now you're the future. And it's really important. And I hope we've seen today how basically the ethos of the Global Coalition is together as the total radiotherapy community, all of us industry, everybody all together, residents, physics, everybody, we're stronger together. And as it could clearly be seen, there's a lot of ways that a residency group could really function. The advocacy piece, very clearly shown then, asking people for mentoring upwards as well. We have connections, you know, with all the big players, really important. Education, as Ben's been going on about how you can actually make that happen for yourselves as well, contributing and collaborating with the Radiotherapy Task Force. And I think just what I wanted to dip into now for a few minutes was the digital transformation, because obviously this is alluding to some of what Ben's been saying as well about this is the subject in medicine that is the most technologically advanced now. And I think we've got a real way to go to actually show it and see it how it can work, particularly you young people, which it's very second nature to you. And I think we should be pushing how a digital transformation could help this. We've got to get away from the old thinking in radiotherapy. There's been, we've just published our white paper on it, and it's about how making the case publicly and to bodies that technology developments is low risk, low cost solutions, and it will guarantee to improve quality. There are technologies, there's software and radiation equipment and remote learning that can transform what we do around the world. I think then we take it to a level with the GCR of trying to ensure national cancer plans recognise that investment in radiotherapy technology is one of the most cost-effective actions a government can make to improve cancer care. We know that 40% of cancer cures involve radiotherapy, and we know that not enough people have radiotherapy. 38 countries in the world have no radiotherapy. The HERO data from Estro showing how countries just don't irradiate people because of this access. And digital technology is a multiplier for the workforce and quality and rapidly improving access. So we also think that a digital transformation strategy, industry talks about that in all sorts of industries, but we should be talking about that in national radiotherapy plans. We can use a focus on competency-based training, how new clinical staff are trained, linking, you know, whether it be centralized planning or centralized training, and then a better way of collaborating with companies, because we must recognize now that the technology developments in radiotherapy are in with the industry. So we must be hand in glove with them. They're our friends, there's only a few of them, and we must be developing these with them. And I think we can expand the capacity in hospitals for accessing clinical resources by using a lot of digital solutions. And I feel particularly now you've been probably watching the UK and are messing around with what are we doing at the top level, but certainly a certain overt recognition that money's tight now, and now we've got a public health system, that we've got to be smarter and we've got to make the money go faster. There is a global crisis in economics. We must make sure radiotherapy is at the front there and that these digital solutions are the answer. So we want to really, with the white paper, create a global digital radiotherapy technology task force, and that really could be a reference centre to help advise other countries. And really, you residents are going to be absolutely key to this, because you're there in it at the moment and probably need to educate up as well. So I don't want to spend any more time on that, because I know we've got to do the breakout sessions, but a great future here in radiotherapy, and absolutely your residencies, you're the future. Need to get on with it.
Thank you so much, Pat. We're going to go ahead and do those breakout rooms right now. We have a list of questions. These questions will be added to the chat, as well as what Ben introduced to everyone. You'll automatically be assigned to a breakout room. There will be 4 to 5 participants in each room. You can choose who you'd like to kind of lead the conversation if you don't already have someone who's like pre-assigned as the moderator. And we'll be coming back to this larger Zoom room just 3 minutes before the end of the hour. Okay, so let's really take our time. And if you have an opportunity to take some notes too, or put things in the chat, those will be recorded as well. And then to close out, I'm just going to hand it over to Kyra. We just really appreciate you all joining us today. She'll give us our final words as we head off, and we'll plan for the next meeting. Kyra, are you back in?
Yeah, I'm here. All right, thanks you guys. Again, really thank you for coming out today, taking your time to hear what ideas have been going on and bring your own ideas to the table. I think we're going to send out a survey after this, kind of talking about where we go from here. So I really appreciate it if you fill out the survey, and we'll kind of spread it. and share this group with others, because I know there's a lot of people out there with really keen interest in global oncology, and a lot of people have really incredible ideas. I mean, within my breakout room alone, I was blown away by all 3 ideas. So there's a lot of enthusiasm and a lot of forward momentum. So let's keep it going. And I want to get people connected with the right subset and right group of leaders who they need to be connected with to really push their ideas and make things happen. So look out for that survey. Also think about World Cancer Day, which is coming up in February. I believe it's February 4th. So that will be a good opportunity, a good launch pad for lobbying, for advocacy, for pushing your initiative. And then we will probably do a pre-launch meeting sometime in January. So, you know, start thinking about what that would look like, especially like what Pat was talking about with utilizing digital media and really transforming that to spread the word, and get, you know, get feet on the ground and things done. So again, thank you all for coming. My email and Twitter and stuff is in the chat. You can, you know, get on the GCR website and find us on social, and there's lots of ways to connect with us, but happy to take emails directly. Any ideas you have, any, you know, you want to connect with someone who's in education or someone who's specifically in lobbying, or whatever idea you have, feel free to reach out. Happy to couch any ideas or discuss further. So, but again, thank you all for coming. I really appreciate it. And thank you to our presenters for such a wonderful and inspiring sort of discussion.